Medicare enrollment is underway, and for many seniors, the process is confusing and it's overwhelming. But before you let your current plan auto-renew, take a moment to review, especially if your health needs are changing. Verda Health Plan of Texas offers accessible, affordable, and culturally sensitive help, especially for underserved communities. Here to share how they're making Medicare more understandable and more personal are President and CEO Frank Vo and Chief Growth Officer Christopher Bond. Good morning, gentlemen.
Good morning.
All right, let me start with this question. How many times do people call in and they're confused between Medicare and Medicaid?
All the time.
All the time, all the time. All right, so let's clarify what Medicare is and who it is for.
Medicare basically for every single member 65 and above. Under 65 tend to be a little bit more physical challenge and with condition. But other than that, basically 65 and above senior.
Yeah, all right, you retire and then that's one of your benefits is to take care of your health care needs. All right, the whole idea of reviewing, you know, so many people get busy and they stop and they go, oh, you know, I just can't get around to that. But even if you don't renew, you should obviously review, right?
Yeah, well, every year, I mean all the time, our health changes. So as your health changes, as you get older, you want to make sure that you're looking at your health coverage to make sure if it's meeting your wants and your needs. And Medicare Advantage plans like Verda Health Plan of Texas offer additional benefits above and beyond Medicare coverage.
And there's other things that make you unique. Okay, Houston is such a diverse city, as we know. And so, Frank, you understand those cultural differences because you immigrated here from Vietnam.
Correct.
Yeah, you have such a cool story. Your family started out on a boat and then had to get turned around. You ended up coming back on your own?
By myself, actually about 8 years old. Basically, no family whatsoever. And actually migrated to Canada first, and then the first state and also city in America is actually Allenton, Texas.
Yeah, wow. 20 years later, you reunited with your family.
Correct.
But you wanted to do meaningful work for your career. You wanted to help underserved communities, and it led you to the healthcare field. You co-created 3 other health plans: Honored Citizens Choice Health Plan, Easy Choice Health Plan, and Estiva Health. But your inspiration for Verda Health Plan came from your personal experience in helping your mom.
Correct. Basically, my mom actually with cancer, and with her last 8 years, well, basically I'm taking care of her, maneuver through all the ecosystem in America with the different languages, and so doing so, she be able to actually last a little longer. And then I continued with that work after my mom passed away. Yeah,
you realize how broken the healthcare system was, and it's very hard for a lot of people to navigate. But especially if you're someone who's immigrated and you're a citizen or resident here, and trying to figure that out with that language barrier is tough. And so you all address that language barrier. You have people who can speak various languages.
Yes. So we create a community center in such a way that we can actually try to reduce every friction. Member can actually go straight directly to the community center to speak their own language, even Chinese, Vietnamese, Tagalog, Korean, Indian, and as well Cambodian and Laotian.
And this is how
Hispanic as well.
Yeah,
Hispanic.
That's it. Yeah,
yes.
But this is how specific you can get. For example, there's a thing called bird's nest, which some people might know if they're familiar with the Asian community. Other people might not know, but you can drill down on something like that as well.
Oh, bird's nest in the ancient history in China is basically the royalty food for the royalty. So therefore it is to enhance your longevity and enhance your body temperature so that they can balance out all the heat and as well the yin and the yang.
The alternative to traditional medication. All right, there are different things that people can do here to fit whatever they need. You offer a zero copay?
Zero copays for there's zero premium for the plan as long as you have Medicare Advantage. I'm sorry, Medicare A and B. We offer, that's the advantage, is it's zero for co-payments for primary care physicians, for the specialists, and for inpatient hospitalization, which is a big benefit and provides peace of mind for our members.
Yeah, all right. There's the extra benefits in plans can include, one of them is up to $3,240 annual allowance, depending on the plan.
Yeah.
So, yeah. Here's the thing. Some of this may sound confusing to you all at home, but that's the point of getting with you, so you can explain exactly what it is that you're getting, because that's the important piece. There are so many moving parts that you can get that can be such an advantage to you if you run across something. So explain that part.
Yeah. So we offer a flex card, which is basically basically like a debit card, and it's up to $3,240 in additional supplemental benefits that are extremely valuable for our members. So above and beyond the Medicare coverage, this is the advantage that we provide beyond Medicare. So whether it's over-the-counter drugs that you want, you can use the Flex card. There's a portion that's allocated for over-the-counter. There's a portion that's allocated for groceries, which is huge right now, especially when seniors have a limited budget. And also
caretakers. That's a huge one too.
Yeah, we offer a companionship benefit, which is important because seniors are, they suffer from isolation in a lot of instances. So companionship benefit goes up to 60 hours of companionship.
Transportation.
Transportation is also important because that's also very limited for seniors. So all of these benefits are important key items that I think most seniors want to call in or come to our member resource center and find out what these options are, what we cover, make sure we have their doctors, their prescription drugs covered. We have an amazing formulary, and they get all these additional benefits as well.
And you said something, like you said, a lot of important stuff there, but one of the big ones that catches a lot of them off guard is like make sure they have their doctors, because doctors will come in and out of network.
Correct.
And even if you move to another zip code, that person can be out, right?
That's right. And the other thing that people tend to forget is while we all understand the importance of having a physician relationship, you, me, we all have a doctor, but doctors also retire. So there's also some opportunity where you may have to look at different physicians in order to get the benefits that you need. We want the doctor, but we need certain benefits.
And you have to know.
That's right.
All right. Also, the max out-of-pocket, $999.
Yeah, so $999 on our chronic special needs plan that is designed for diabetics or those with congestive heart failure or cardiovascular disease. That basically gives our members peace of mind that they will not exceed $990 in annual spending for medical benefits.
Yeah, and that's a deal.
Yeah.
I mean, look,
our medical expenses.
A dollar can be hard to come by for a lot of us, but that's a deal when you look at the cost of medical procedures and things. All right, Seniors Getting Social. You have the Resource Center, the Member Resource Center.
Yeah, the center designed not only reducing all the friction. Why I get this bill? Why can I actually have access to certain care, specialty versus the PCP. Not only that, but they actually can participate in like drawing class, scam,
tea parties, karaoke.
Yes, we had a Halloween. Yeah, we had a Halloween activities yesterday, and we were in the Member Resource Center. And they were singing karaoke. They're having an amazing time. It actually opened. Our grand opening was last September. And we've expanded it 3 times the size because of the growth of membership.
Wow.
So,
wow. Yeah, because you cover a wide area, Fort Bend, Harris, Montgomery counties as well, and expanded to Dallas and Collin for 2026.
Also expanded to Maricopa, Arizona. So Maricopa County. So, if your viewers have friends or family that are eligible for Medicare in any of those areas, you can also give us a call.
Yeah. Gentlemen, thank you very much.
Thank you.
I would say that in 5 different languages, but I can't. All right. Verda Health Plan of Texas has multilingual representatives ready to take your call right now and walk you through the process to get you enrolled. Remember, they offer $0 copay for a primary care physician specialist, inpatient hospitalization, urgent care, and so much more. You can enroll now through December 7th by calling 877-419-2730. Again, that number is 877-419-2730, or visit them online at verdahptx.com.